You're listening to The Bird Bath, presented by The Fountain Report. I'm your host, Ryan Leach. Welcome back to The Bird Bath. Each week, we scrape the surface of the news you need to know, so let's get into it. This is a fun and special week. I'm recording live at the AVMA convention in Austin, Texas. So if my voice is feeling or sounding a little more tired or worn than normal, it's after several days on the conference floor and meeting with incredible people from across the space. So the voice might not sound as good, but hopefully the insights will continue to be great. So to everyone that I've met throughout this week, it's been awesome. I've really enjoyed getting to know people. And our top story is something that I alluded to last week, which is a very special project that I'm working on with Zoetis and a collection of incredible people from across the space. So the first day or the day prior to the conference opening, Zoetis brought together a mountain of incredible people, chief medical officers, chief veterinary officers, deans of the universities, presidents of large organizations. The AHA was there, leadership from the AVMA, and just people across the way that I felt definitely out of my depth with the incredible resources of people. But the task was a workforce industry workshop. So it was a collection of people that could tackle the workforce issues that we're seeing in the industry. And it was bucketed into sort of three groups and three categories that are all, you're going to be hearing from them, I hope, over the next year as things continue to develop. But there was a team working on technician utilization and technician workforce, as well as the team utilization and team workforce. So the understanding of really optimizing and leveling up the skills so that people can work atop a license and participate across the entire industry and in the clinics, really finding a way for people to be able to implement and utilize the entire team. So that was really interesting. There was a team talking about culture and trying to find a way that we can improve a overall level of culture within the industry. And then finally, I was able to participate in the technology portion of the talk, which was the idea of finding a way to bring permission and open the door for people to explore new technologies that are happening in the space. So as I said last week, I got the opportunity to sit down with Dr. Richard Goldstein, who's the new Global Chief Medical Officer for Zoetis. And I asked Rich just to summarize what this week meant and the things that happened and what people should expect to see going forward.
Sure. And thank you for having me, first of all. And thank you very much for coming to that session yesterday. So Zoetis, obviously, like others, is heavily invested in the health of our profession, right? The veterinarian is our primary customer. And so we are all in to do whatever we can to help the profession grow, move forward, and heal, honestly, because there are issues in the profession right now. I think that we are all aware of, and I know you've talked about them in this podcast before, of lack of people, lack of trained people. And it's not just veterinarians, it's veterinary technicians, it's the whole veterinary health team, right? And then people leaving the profession. And that's really where we feel like we can make a difference, is how can we kind of help with the retention issue of veterinarians, veterinary technicians, all the clinic staff, to make people feel better about themselves, about their job, to help them practice better medicine, help them give better service to the pet owners, and less stress and just more happiness in the job. And I think if we can do that, we will make a serious contribution to the health of the profession and to the ability of us to serve the veterinarians' customers, which are the pet owners. So I think if I could summarize all of the outcomes, it's around functioning better as a team and running a practice in a more efficient way, to be able to do what we went to vet school and to tech school for, right? None of us went to vet school some maybe did to be business people, but none of us went to do paperwork and to do accounting and to do inventory. So how do we figure out how to run our practice in a way that we can focus on the pet and the health of the pet, and use technology, for instance, to do some of the other stuff, and work as a team? And in the veterinary technician side specifically, a lot of it, I believe, is about still not understanding widely in the industry that being a veterinary technician, or a nurse, as we're allowed to call them in some places, is a profession. It's a profession that it's a career. Right. They're a crucial part of the veterinary team. I mean, show me one successful veterinary practice that does not have really good technicians and nurses, and I will say that's probably not true.
Yeah,
so it's the key to everything. And so how do we make sure that is a career, that there's a career path, that people are appreciated, that they're allowed to practice to the limit of their license. That's what yesterday was all about.
Again, thank you so much to everyone at Zoetis and Dr. Richard Goldstein for sitting down. You're going to continue hearing more about this. So our goal here is to find a way to attract top talent into the veterinary industry and retain those people and find a way for them to really love and enjoy this industry that means so much to all of us. Our next story is a controversial one from the New York Times. Over the weekend, they released a story that's got a lot of coverage, especially I think if you're at a conference surrounded by the industry that the New York Times writes about, you hear a lot of grumblings. But the New York Times put out a piece, and Katie Thomas, who's their healthcare reporter, put out a piece called "Why You're Paying Your Veterinarian So Much." She sort of weaved through a story, starting with a lady that received a very high medical bill after MRIs were done and for a cancer treatment for her dog. She utilized an alternative payment method and went into debt over that. They talk through the story of rising costs of healthcare. I think she did a nice job of balancing the understanding that the costs are rising, and I don't think anyone can dispute that. But there is also an increase of the quality of care and the technology of the medical tools that are being utilized, as opposed to just giving a pain medication and sending the patient home. We're seeing an increase of tests and diagnostics being run to hopefully find the cause of the issue. But again, that increases the cost. So there's been a lot of talk and grumbling, both online as well as within the convention halls, from people that were asking, did we hit clearly in this story? And did Katie from the New York Times, did they cover the understanding of a spectrum of care? Who was really interviewed? Who was the top people that were sourced here? And, there definitely are some gaps. Some of the people that were referenced, and I know she interviewed many more people that raised their hand after the fact here, but spoke to people that had been out of the industry and were not really fully engaged in where the veterinary industry is today and a lot of the things that are happening. So I know a mountain of people are working to try and increase access to care, as well as we're trying to increase the quality of medicine that continue to be provided. So it was a very interesting story. You'll hop on LinkedIn, hop on your Facebook groups. I know you're going to see it posted, and something to really dig into and see. The New York Times has been covering the vet industry quite a bit lately. Forbes has jumped in. So it's something that we're going to see more and more people from outside the veterinary community come in and discuss our industry. So be sure to check that piece out. Whether you agree with it or not, it's important to keep yourself abreast of what's happening. I want to hit on a couple other stories of what happened at the AVMA conference. I'm here. I thought it was very special. It was a fun time to get to meet a lot of new people. I was very appreciative of a lot of doors that were opened by the AVMA for me to participate in conversations with people that have different opinions on things and people that have similar opinions. One event, though, that I really wanted to highlight was a special event that Hills put on with the Street Dog Coalition. So Hills Pet Nutrition, the food company, and their parent company, Colgate-Palmolive, announced that they've partnered with the Street Dog Coalition. And Street Dog Coalition is here in Austin, and it's a nonprofit organization dedicated to providing free veterinary care and related services to pet parents experiencing or at risk of homelessness. It's a big issue. It's something that I think we've all have seen, and many people have probably engaged with the difficulty of the love of our pets and the love of being around them and caring for them, and the major impacts that has on homelessness and the difficulty of trying to care for humans as well as their pets. It was part of the One Health initiative that you've probably heard a lot on. But the initiative was kicked off just this week. And what they did a pop-up veterinary clinic to sort of spearhead this. And they met with the Street Dog Coalition, Hills, and they provided a lot of free care for people as well as their animals within the Austin, Texas area. Dr. Hillary Wheeler, who's the medical director for the Street Dog Coalition, said, as longtime partners of Hills Pet Nutrition, we're thrilled to expand our collaboration. The increased support allows us to make vital veterinary care and pet nutrition more accessible while also supporting people's oral health. So teeth are a gateway for a lot of medical issues. And so partnering with Hills as well as that Colgate-Palmolive and their suite of products was really interesting. And Dr. Karen Shenoy, who's the chief veterinary officer for Hills, said our partnership is about more than distributing pet nutrition or essential health and hygiene products. It's about empowering pet parents who are experiencing homelessness or at risk of experiencing homelessness to help them keep themselves and their pets healthy so they can enjoy more time together. So it's an initiative I thought was really important and wanted to highlight. So make sure to check out what they're doing there. Finally, one of the big things that happens at the AVMA conference is the elections. So it was a pretty historic election. I wanted to make sure that I took a second to highlight the new president-elect, who's Dr. Michael Q. Bailey. The historic component of this is that Dr. Bailey is elected as the first Black president of the association. He's going to take over when Dr. Sandra Fay, when her term expires in next July. And it's funny, I had a moment to sit down with Dr. Bailey, and he said, I've got 3 years, which is funny when you think about being the president for one. But for the AVMA, if you're not familiar, you have a year as the president-elect, you have a year as the president, then you have a year as the immediate past president. So you have 1 year of sitting in the big seat, but multiple other years of participating and helping the industry move forward and grow. I met with Dr. Bailey after a really cool talk from what they call DEI legends in the space, which was a panel of the pioneering Black deans of universities across the industry. It was very eye-opening to hear the continuous struggle that some of the panel and brought up, as well as the need to continue finding an increase of equity and inclusion. It was powerful. It was really special to hear that, and it was really special to hear that talk happen. So to Dr. Bailey, congratulations on the election. Can't wait to see what you do. I think from our quick talk, you said you're going to bring changes, and you're excited to do that. So I look forward to finding a time to sit down and do an interview and talk about some of these hot button issues that are happening in the space. Which leads me to a special episode that we have coming out on Friday. So you know, we sometimes can get these special Friday episodes, and something I want to bring to you more often, but we were absolutely thrilled to have the opportunity. And this week I sat down with Dr. Rena Carlson, who's the immediate past president. She was still president when we sat down, so that was a fun little intermediate there. And Dr. Paula Parker, who's the AVMA's Chief of Professional Relations and Strategic Initiatives. I asked them what I thought were the questions that you all want to hear about. We talked about the workforce shortage and the variety of the data that we're seeing from that we've reported on here versus the data that we're hearing and the talking points that we get from the AVMA. We also talked about telehealth, telemedicine, teletriage, and where that's going to fit into the care. I also, got the chance to hear from Dr. Carlson about what she hopes the new presidents can do and her advice to those moving forward. So it's a 30-minute episode. It might be a little bit shorter after we edit it, but it was something that I think hopefully addresses some of the questions people have. At the end of it, I think we all said we could have talked for 5 hours. So hoping to just make this a first of many opportunities to open the door for people with different views to communicate here on the show. So make sure to check out Friday's episode. And as always, I appreciate everyone listening. And for more on these and other stories, be sure to subscribe to the Fountain Report. There's always a link in the bio. And don't miss out on any episodes by subscribing and rating the show. For the Bird Bath, I'm Ryan Leach. See you next week.